Hi, my name is Fran Castellow, and I'm the President of Operations for Patient Advocate Foundation. Today, I'm here to talk with you about some important changes and updates to the Medicare Part D benefit that will be effective in January of 2025. Before we get into those changes, I want to kind of take us back to 2022, talk a little bit about what the Inflation Reduction Act is. You may have heard about this in the news. It was a very large piece of legislation that was passed by Congress in September of 2022. It had a lot of different provisions included in it, including some healthcare provisions that impacted Medicare Part D. So Medicare Part D is the pharmacy benefit that Medicare beneficiaries typically buy or receive through their Medicare Advantage plan, and it covers their drugs at the pharmacy. So the Inflation Reduction Act did several key things, and it was phased in over time starting in 2023 and actually will continue being phased in out through 2026 and beyond. Some of the some of the benefits of the Inflation Reduction Act were that the out-of-pocket pharmacy expenses on Medicare Part D plans are going to be capped at $2,000 beginning in 2025, and we're going to talk quite a bit about that today. It also extended subsidies for the low income up to 150% of the federal poverty level. So that's our low income subsidy, also called Extra Help. That extension and expansion started in 2024. Medicare actually is, for the first time, going to be able to negotiate some drug prices directly with manufacturers. The negotiation has actually started taking place already, but the impact of those negotiations won't be felt until 2026 and beyond. Vaccines were made to be free for all Medicare beneficiaries. And there were also a couple of cost controls that were put into the bill, including that price hikes on drugs cannot outpace the level of inflation. As well, premium increases on the health insurance premium side cannot exceed 6% annually. But I want to point out an important note here. That does not apply to Medicare Advantage plans. About 50% of all Medicare beneficiaries have a Medicare Advantage plan. That means it's very likely that people in the Medicare Advantage plans will see a greater than 6% increase in their insurance premiums to help pay for the reduction in costs on the Medicare Part D drug spend. And finally, insulin costs were capped at $35. It's really likely you heard about that in the news. That was one of the first changes that was implemented under the Inflation Reduction Act back in 2023. So let's talk about Medicare a little. Let's level set on what are the different parts of Medicare. This is not meant to be an extensive education on Medicare, but just to kind of give us a grounding. So Medicare Part A is the hospital coverage. That typically covers inpatient hospital services, skilled nursing facilities, hospice care, blood transfusions, things like that. So kind of think anything inpatient. That's going to be billed to Part A of the Medicare coverage. Part B is your medical coverage. Those are expenses related to going to the doctors, so physician fees, outpatient services, some home health services, durable medical equipment, HCP administered drugs, and HCP is a healthcare professional. So those are your injected and infused medications that you receive at the doctor's office, and some preventative services. So Part B covers all the things that you typically access at your doctor's office or specialty outpatient facility. Part D is what we're here to talk about today. That's the prescription drug benefit. That's actually a voluntary benefit. You don't have to buy a Part D plan, but it certainly benefits Medicare beneficiaries to have a Part D plan because that's the only way you're going to have coverage for any medication that's dispensed at a pharmacy or a specialty pharmacy. So Part D is really important, and that's where all these changes are occurring. And then Part C really is, think about it in this way, it's a combination of Part A, B, and D. And that is also called a Medicare Advantage plan. As I mentioned earlier, about 50% of all Medicare beneficiaries have purchased a Medicare Advantage plan. And in one plan, it covers your hospital, your medical coverage, as well as your prescription drug coverage in most cases, and may offer some additional benefits such as dental or vision or wellness programs. So kind of with this background, let's dig into Medicare Part D. Let's start with now. So who's paying today in 2024, and what are the different phases of coverage? So let's start with the phases. There are 4 payment phases, if you will, that make up the Medicare Part D benefit. So there's the initial deductible phase. That's typically paid for by the beneficiary at 100% if there is a deductible. That can be anywhere from no deductible up to a few $100s. And what that means is the first few $100s of this expenses for pharmacy products, the beneficiary is going to pay. Once you get through that deductible, you're in the initial coverage phase. That is kind of a shared point at the plan design where the beneficiaries and the plan sponsors are bearing the cost. So the beneficiaries pay about 25% of the medications that they pick up from their pharmacy or get from the specialty pharmacy, and the plan sponsors are going to be paying the other 75%. So that's your health plan. Then there's what's called the coverage gap phase. You may have heard of it referred to as the donut hole. That is a point at which the federal government is not paying for any of the expense, and it's being really the patient is kind of more on their own, if you will. They pay about 25% during that coverage phase. The plan sponsors drop back to about 50%, and actually the pharmaceutical manufacturers fill in the gap with about 70% of the payment. And then there's what's called the catastrophic coverage phase. Only about 25% of all Medicare beneficiaries ever reach the catastrophic phase in their Part D plan. However, those that do are subject to pretty significant costs. Until 2024, beneficiaries kept paying 5% of their costs. You can see a huge and a beneficial change in 2024 as that was dropped. That catastrophic coverage phase today is paid by the federal government, 80% of it, and then the plan sponsors kick back in about 20%. So let's take a look at how that's changing in 2025. So the most noticeable thing is that the coverage gap phase, that point at which where the patient is paying the most, is now gone. And this has been something that legislators and others have been working towards for a very long time, really since the Part D benefit was implemented back in the early 2000s. So now it's going to look like this. The initial deductible phase will still be the responsibility of the beneficiary at 100%. The initial coverage phase is now going to be shared by the beneficiary, plan sponsor, and the pharmaceutical manufacturer. And the catastrophic phase is going to be shared by the government, the plan sponsor, and the pharmaceutical manufacturer. And I think one thing I want to really draw your attention to is the shift here. There's a benefit to everybody in the payer kind of ecosystem except the plan sponsors. They are actually going to be paying more in this new plan design than they have been in the past. The government will be likely paying less, and the pharmaceutical manufacturers will likely be paying less. And the good news in all this is the beneficiaries are going to be paying less. I bring that up though because there are likely going to be some implications on health insurance premiums within plans to help pay for this. So let's look at an example of how this is going to change for Medicare beneficiaries in 2025. So on the left, 2024 is an example of this initial deductible phase, initial coverage phase, coverage gap, and then in this example, we don't have a catastrophic coverage phase for the patient. So you're paying $545 as an initial deductible phase or up to that amount. And then you can see an additional $1,258 in the initial coverage phase, and then about $3,135 in the coverage gap phase. So all together, you're talking about well over $4,000, almost $5,000 that a beneficiary would pay before reaching that catastrophic level where they would not owe anything. In 2025, that is dramatically changing. No Medicare beneficiary will pay more than $2,000 for their Medicare Part D drugs. Remember, that's just the ones coming from the pharmacy. There's no change to the plan design in the Medicare Part B benefits. So infused and injectable products are not being impacted by this change. So you still see that the initial deductible phase, if your plan has one, you will be responsible for that deductible. And then in the initial coverage phase, up to a total of $2,000. That includes your deductible. So at no point will a Medicare beneficiary pay more than $2,000 for their medications coming from their pharmacy or specialty pharmacy beginning in January of 2025. So that is obviously the largest change from a benefit design perspective that has been made to the Medicare Part D plan, benefit design really since it was launched. So it's a significant improvement for Medicare beneficiaries that are already paying more than $2,000 a year. But I want to stress the fact that if you're not paying $2,000 a year in costs, this really isn't going to give you any relief. It's not going to reduce your costs. It's simply putting a cap or a ceiling on the maximum amount that you might pay. I think that's important because in the kind of out in the environment, there's a lot of conversation about this change and this $2,000 cap saving people money. And it will. It will save those people, 25% of Medicare beneficiaries, who are already spending more than $2,000. It will save them money. Everyone else is going to be subject to pretty much the same spend and responsibility that they have had unless their drugs change or they have a need for additional treatment. So let's move on to our second topic for today. And this is really revolutionary, quite different, and something Medicare has never done. It's called the Medicare Prescription Payment Plan. This was also part of the Inflation Reduction Act, and it is a plan that allows people to basically spread out their costs over time. So instead of paying for their Medicare Part D drug costs all at once, so let's say January comes, you go pick up your medication at the pharmacy, it's a very expensive medicine and your responsibility is $1,200. Today, you would have had to pay $1,200 in order to pick up that medication and take it home with you that day or have it shipped to you from your specialty pharmacy. Beginning in 2025, you will have an option to opt into what's called the Medicare Prescription Payment Plan, or smoothing is another term that's used, and pay for that expense over time, over monthly installments for the remainder of the year. This only applies to Part D and Medicare Advantage plans that offer Part D benefits. So this payment plan option is not available for hospital expenses or provider expenses. So let's look at some key features for the Medicare Prescription Payment Plan. As I mentioned, it spreads out the out-of-pocket drug cost across the year. It is completely voluntary. You your person you're working with, the Medicare beneficiary, has to opt in to this plan. You will not be opted in automatically. You can enroll before the plan year or any time during the plan year. So open enrollment season is occurring now for Medicare Part D and for all of Medicare, actually. So if this is something that seems like a good fit, this would be the time that you could opt in. You may get into next year and decide it's really not a good fit and you opt out. You can do that at any time. The enrollee will pay no money at the point of service for the drug covered by Part D. So that was my example I gave. When you go to the pharmacy, if you owed $1,200, you would no longer pay that day. Instead, if you're in this prescription payment plan, your pharmacy would bill your health plan for that $1,200. And then your health plan would send you a bill, or the person that you're working with, the Medicare beneficiary, a bill each of the next many months of the year until the end of the year for that expense. And then you would pay your health plan directly. The bill, the amount for each month cannot exceed a monthly maximum cap, which I will explain in just a moment. And just in case you read some articles or watch some other educational pieces on this particular payment plan, you may hear the term smoothing, MPPP, or M3P. Those are all kind of synonymous for Medicare Prescription Payment Plan. So how might this work? This is a good example, and this is kind of the perfect example, if you will, of somebody who picks up an expensive medicine or is prescribed a medication that costs $500 a month beginning in January. So if the cap is $2,000 under our current benefit, you would have paid the $500 January, $500 in February, again in March, and again in April to reach your $2,000 out of pocket. You have an option, though, to spread it out over all 12 months. So that would become $166.67 a month for 12 months. Then that would be all that you would pay for the entirety of the calendar year were you to stay on that drug all year. There is a second example that I would like to point out, and that's, let's say you are newly diagnosed and you change medications and you're prescribed a $500 a month drug in September. I don't know that the Medicare Prescription Payment Plan is going to be all that beneficial to you at that point because the outcome's the same. Because there's only 4 months remaining in the year, you would pay $500 each of those 4 months, which is exactly the same as if you were not in the Medicare Prescription Payment Plan. So let's look at some examples, because I think it's a really important point to make, is that the Medicare Prescription Payment Plan, it isn't for everyone. It does benefit some people, and the Centers for Medicare and Medicaid Services have been very specific in their guidance in saying that it may benefit some people. Likewise, it may not be the best option for others. So let's take a look at 3 case studies and kind of decide, based on the financial situation, the medical history, current medications, and the social history of these folks, whether or not this payment plan might be in their best interest. So this is Joanne. She's a 76-year-old widowed retiree living on a fixed income. She resides in a rural community. Her medical history of congestive heart failure, COPD, and osteoporosis has been managed through multiple hospitalizations in the past year due to heart failure exacerbations. Joanne lives on Social Security income, and it puts her at about 125% of the federal poverty level, qualifying her for the low-income subsidy or extra help. She has original Medicare and Medicare Part D. She requires a complex medication regimen, including multiple brand name drugs, inhalers, and injectables. Based on this profile, do you think Joanne should opt in to the Medicare payment plan? Probably not, and let me help you understand why that is. Since Joanne is enrolled in a low-income subsidy, her prescription costs remain low. That's the point of the extra help or the low-income subsidy program, is to reduce the overall out-of-pocket cost for the lowest income Medicare beneficiaries. The new Medicare Prescription Payment Plan would likely provide very minimal benefit to her and would create a lot more administrative burden for her by receiving bills every month from her health plan that she then has to pay them. She may prefer to just continue paying for her prescriptions upfront as she has done in the past, as the cost will be relatively low. Let's take a look at Tomas. He's a 47-year-old former high school teacher. He's married and lives in the city with his husband and their 2 dogs. He has hemophilia, Crohn's disease, and high cholesterol. No recent hospitalizations or major surgeries. He receives Social Security disability benefit due to a rare disease that he has. Combined with his husband's income, his family sits at roughly 375% of the federal poverty level. He receives Medicare benefits through an Advantage plan, and since he takes some expensive medications, he utilizes a charitable co-payment assistance organization to help him manage the costs. His current medications consist of statin, blood clotting factor, and an injectable biologic. Should Tomas opt in to the Medicare Prescription Payment Plan? Maybe not. So this is not a probably not or a definitely not. It's a maybe not. The structure of the new Medicare Prescription Payment Plan involves monthly payments paid directly to a beneficiary's insurance company. So the process is going to be vastly different than what we're used to, where we pay right at the pharmacy. Opting in might complicate the charitable copayment assistance that he is already receiving, since Tomas will now get a bill from the insurance company that he will need to pay upfront and receive reimbursement, or the copayment assistance organization will need to pay it on his behalf. That's very different than what Tomas currently experiences, while the charitable copayment assistance program provides to him a virtual pharmacy card where he can pay for his copays and cost share right at the point of sale. If he were to opt into the smoothing program or the Medicare Prescription Payment Plan, he will still get access to his medications, but the way that he will pay will be different. He will now be subject to receiving monthly bills. As I mentioned, he will either have to be prepared to pay and get reimbursed, or he will have to submit to the Charitable Copay Assistance Foundation to then pay the health plan. It is important to note that some health plans do not accept third-party payments. So, all this to say, it may not be in his best interest to opt in to the smoothing program because the charitable organization, is really already relieving some of the financial distress that he has in making those payments in the first place. Lastly, let's talk about Martin. So Martin's a 75-year-old retired engineer. He lives with his wife in a suburban community, has prostate cancer and hypertension, and he's already completed surgery and radiation. However, his recent PSA test indicates a recurrence. The cancer has metastasized to his lymph nodes. Between Martin's retirement and his wife's, as well as their Social Security, their annual income falls at 600% of the federal poverty level. Martin receives Medicare benefits through Original Medicare and a Part D plan. He also holds a Medigap coverage. His current medications include hormone therapy, pain medication, and an antihypertensive. Should Martin opt into the Medicare Prescription Payment Plan? He should definitely consider it. Since Martin is on a costly hormone therapy, he will have large out-of-pocket responsibility near the first of the year. His income exceeds the eligibility criteria for most of the charitable assistance programs, including low-income subsidies or extra help, and most of the manufacturer programs were they to offer Medicare beneficiary support. The new Medicare Prescription Payment Plan could benefit Martin by providing a more predictable and affordable way to manage his prescription costs. So as we close, I just want to cover a few really key takeaways. So first and foremost, just a reminder that open enrollment is October 15th to December 7th, 2024. Please take advantage of that opportunity to review your coverage or enroll in new coverage, making sure that the coverage is right for you and your current situation. Medicare Part D, those paying more than $2,000 annually for their drugs will pay less. All Medicare Part D beneficiaries will be capped at no more than $2,000 out-of-pocket cost for their pharmacy-based products. A reminder that about 25% of Medicare beneficiaries currently pay more than $2,000 annually. Medicare Part B, there are no changes to Medicare Part B. Drug costs will still be billed as they are now. That includes your infused and injected products. Insurance premiums for Medicare Advantage plans and commercial plans are very likely to increase beginning in 2025. That is a way that the plans can help pay for the reduction in the cost that the beneficiary is paying for the Medicare Prescription Part D plan, Part D drugs. The Medicare Prescription Payment Plan launches January 1st, 2025. It is complicated. I hope that you could see that from the case examples. And the income level of the person that you're working with, or your own income level when you're considering this payment plan, it really does matter. The reason for that is because patients who have a much lower income level, so 150% of the federal poverty guideline or less, are eligible for the low income subsidy or extra help. And those between, the poverty guideline and roughly about 500% of federal poverty guideline typically are eligible for a charitable copay grant if one is available, those folks may not benefit from the program because there's alternatives that are helping fill the gaps for them and pay for those medicines at the point of sale when they're being dispensed. Patients who spend more than $2,000 on their Part D medications and are not eligible for the low-income subsidy or extra help or a charitable grant may actually benefit from this program and should consider it with their current circumstances. And every patient situation needs to be assessed before determining if the Medicare Prescription Payment Plan will benefit the patient or themselves. I'd like to leave you with a few resources. These are by no means all of the resources that exist to educate yourself on the Medicare Prescription Payment Plan and all of the changes that are coming into Medicare, into the Part D benefit design in 2025. Patient Advocate Foundation has a Medicare Resource Center, as well as our Education Resource Library. There are several good publications that the Centers for Medicare and Medicaid Services have published, including a Medicare Prescription Payment Fact Sheet. And then I encourage you to visit their webpage specifically about the Medicare Prescription Payment Plan. And then we have included a link to the Health and Human Services guidance. I think the number one thing to remember is it's individualized. Make sure that you understand your benefits, that you've selected a plan based on your medical needs and your financial means, and really do look into that payment plan and see if it is right for you. I appreciate your time and attention today, and thank you for the opportunity.